I am going to discuss sphenoid bone. The sphenoid bone is a single, butterfly-shaped bone located at the base of the skull. It acts as a central keystone of the cranium, articulating with several other cranial and facial bones. It contributes to the cranial floor, the lateral walls of the skull, and parts of the orbit. The sphenoid bone has a central body, and paired greater wings and lesser wings that extend laterally from the body of the sphenoid. It also has two pterygoid processes descending from the junction of the body and greater wings. Here is the posterior view of sphenoid bone. The body of the sphenoid, or sphenoid body, is the central portion of the sphenoid bone located between the wings and processes of the bone. The sphenoid body houses the sphenoidal sinuses. The body has 6 surfaces: posterior, anterior, inferior, superior, and 2 lateral surfaces. The posterior surface of the sphenoid body is the part that joins with the basilar part of the occipital bone. The anterior surface of the body presents the opening of the sphenoidal sinus 2 in number and septum of the sphenoidal sinuses. The opening of the sphenoidal sinus is an aperture that opens anteriorly into the nasal cavity, specifically, into a small space called the sphenoethmoidal recess. As mentioned before, the sphenoidal sinus is a paired air-filled cavity located within the body of the sphenoid. And the septum of the sphenoidal sinuses is a bony partition separating the 2 sinuses. The inferior surface of the sphenoid body features in the middle line a triangular spine called the sphenoidal rostrum. It fits into a deep fissure between the ali of the vomer. And the superior surface of the sphenoid body features the following landmarks: chiasmatic groove, Sella turcica with hypophyseal fossa, tuberculum selli, dorsum selli. The chiasmatic groove, also known as optic groove, is a transverse groove between the right and left optic canals. It is continuous with the optic openings, located just anterior to the Sella turcica. Within the chiasmatic groove lies the optic chiasm, junction of the 2 optic nerves, cranial nerve 2. The Sella turcica, or Turkish saddle, is a saddle-shaped depression on the body of the sphenoid. It lies above the sphenoidal sinus and contains the hypophysis, pituitary gland. The Sella turcica features such structures as the hypophyseal fossa, tuberculum selli and dorsum selli. The hypophyseal fossa, or pituitary fossa, is a depression on the superior surface of the sphenoid body occupied by the hypophysis. The tuberculum selli is a small process in front of the hypophyseal fossa. And the dorsum selli is the posterior wall of the hypophyseal fossa. Each lateral surface of the sphenoid body unites with the greater wing and the pterygoid process of the sphenoid. This surface also has an important feature, which is called the carotid groove. The carotid groove is a longitudinal groove that houses the internal carotid artery and the cavernous sinus. The greater wings of the sphenoid are the larger of the 2 lateral, wing-like extensions of the sphenoid body. The greater wings curve upwards, laterally and backwards to form a prominent concavity or fossa in the middle of the cranial floor. Each greater wing of the sphenoid has 5 surface, cerebral surface, lateral surface further composed of 2 parts, temporal and infratemporal surfaces, maxillary surface, and orbital surface are other main surfaces. Besides the mentioned surfaces, the greater wings has the 4 margins. Zygomatic margin, border that articulates with the zygomatic bone. Frontal margin, border that articulates with the frontal bone. Parietal margin, border that connects with the parietal bone. Squamosal margin, border that connects with the temporal bone. The cerebral surface of the greater wing forms the anterior part of the middle cranial fossa. This surface has foramen rotundum, foramen ovale, foramen spinosum. Impressions of cerebral gyri. Arterial grooves. The foramen rotundum is a circular hole in the greater wing of the sphenoid connecting the middle cranial fossa to the pterygopalatine fossa. It is a passage for the maxillary branch of the trigeminal nerve. The foramen ovale is an opening that connects the middle cranial fossa to the infratemporal fossa. It transmits several vessels and nerves, including the mandibular nerve, the motor root of the trigeminal nerve, and the lesser petrosal nerve, which is a component of the glossopharyngeal nerve, cranial nerve 9. The foramen spinosum is a round, small opening in the greater wing located posterolateral to the foramen ovale. It connects the middle cranial fossa to the infratemporal fossa. The foramen spinosum transmits the middle meningeal artery and vein, and the meningeal branch of the mandibular nerve. The impressions of cerebral gyri, also called the digital impressions, are flat indentations on the inner surface of the skull corresponding to the cerebral gyri which produce them. Also, the inner surface features arterial grooves that are produced by pressure from arteries, primarily the middle meningeal artery and its branches. The lateral surface of the greater wing of the sphenoid is convex and divided into two parts, temporal and infratemporal surfaces, by a transverse bony ridge called the infratemporal crest. The lateral surface of the greater wing is pierced by the foramen ovale and foramen spinosum. It also features the downward projecting sphenoidal spine. The upper vertical part of the lateral surface is the temporal surface. It is the attachment site for the temporalis muscle. The horizontally oriented lower portion is known as the infratemporal surface. It is directed downwards, and together with the infratemporal crest is the attachment site of the upper fibers of the lateral pterygoid muscle. The maxillary surface of the greater wing faces anteriorly and forms the posterior border of the pterygopalatine fossa. This surface is pierced by the foramen rotundum. And the orbital surface of the greater wing faces anteromedially. It forms the posterior part of the lateral wall of the orbit. The upper edge of the orbital surface of the greater wing articulates with the orbital plate of the frontal bone, while the lateral margin articulates with the zygomatic bone. The inferior margin of the orbital surface forms the posterolateral margin of the inferior orbital fissure, while its medial margin forms the inferolateral edge of the superior orbital fissure. The lesser wings of the sphenoid are the smaller of two lateral wing-like extensions of the sphenoid body. They are flattened, triangular in shape, and located above and anterior to the greater wings. Each lesser wing of the sphenoid has two surfaces, cerebral and orbital, and features the following structures. Optic canal. Anterior clinoid process. The optic canal is a passage connecting the orbit to the middle cranial fossa. It transmits the optic nerve, CN2, and the ophthalmic artery. The anterior clinoid process is a cone-like process of the sphenoid on either side of the anterior part of the hypophyseal fossa. Also, the lesser wing of the sphenoid contributes to forming the superior orbital fissure. It is the gap between the greater and lesser wings of the sphenoid bone, bordered medially by the sphenoid body, and closed at its anterior extremity by the frontal bone. The pterygoid process is a paired postero-inferior projection of the sphenoid bone. Each process bifurcates into a medial and a lateral plate. Each pterygoid process also features the pterygoid fossa and pterygoid canal. The lateral plate of the pterygoid process is the lateral division of the process where the pterygoid muscles attach. The lateral pterygoid muscle to the lateral aspect, and the medial pterygoid muscle, to the medial aspect of the lateral plate. The medial plate is the medial division of the pterygoid process. The superior pharyngeal constrictor muscle attaches to the inferior end of this plate. Between the lateral and medial plates of each pterygoid process there is a space called the pterygoid fossa. It is the attachment site of the medial pterygoid muscle. The pterygoid canal is a bony passage that extends anteriorly in the base of the pterygoid process. This canal transmits the greater and deep petrosal nerves from the middle cranial fossa to the pterygoid ganglion in the pterygopalatine fossa. Development and ossification. The sphenoid bone develops from several ossification centers. Body, greater wings, lesser wings, and pterygoid processes develop separately and fuse by adulthood. Clinical relevance. Sphenoid sinusitis. Inflammation or infection of the sphenoidal sinuses can cause headaches or pressure behind the eyes. Pituitary tumors. The proximity of the pituitary gland to the sphenoid bone allows surgical access through the sphenoidal sinus, transsphenoidal approach. Skull base fractures. Fractures involving the sphenoid bone can damage cranial nerves or major vessels. Cavernous sinus syndrome. The sphenoid's location near the cavernous sinus makes it critical in conditions involving cranial nerve compression. Thanks for watching.